Vitamin D may help prevent diabetes. The results. Studies show that people with diabetes are more likely to develop heart disease. 96 million Americans have diabetes. The results of a study show that people with prediabetes who took vitamin D were less likely to get diabetes. The experts say that vitamin D alone does not prevent diabetes. Prediabetes is a condition in which blood sugar levels are higher than normal but not high enough to be classified as type 2 diabetes. Prediabetes can lead to type 2 diabetes. A study of 1,400 people suggests that vitamin D could prevent people with prediabetes from developing type 2 diabetes. People with a vitamin D deficiency were at a higher risk of developing type 2 diabetes than those with higher levels of vitamin D. The researchers found that 22.7% of participants who took vitamin D developed type 2 diabetes, while 25% of those who took a placebo ended up progressing to the type of diabetes. Taking vitamin D supplements may help to lower the risk of diabetes in people with prediabetes. The conclusion was simple. In adults with prediabetes, vitamin D was effective in lowering the risk for diabetes. Vitamin D helps to protect against diabetes. It is important for the absorption of calcium. It also helps to regulate the immune system and reduces inflammation. It is recommended for pregnant women and those who are deficient in it. It can also reduce the risk of developing type 2 diabetes. A basic introduction to vitamin D. Vitamin D is a fat-soluble vitamin that promotes calcium absorption in your gut, without which your bones can become thin and brittle. Vitamin D helps reduce inflammation, immune function, and glucose metabolism. It is a potent antioxidant, anti-cancer agent, and anti-inflammatory. Vitamin D is naturally present in foods like fish, mushrooms, and fortified milk and cereal. Your skin produces vitamin D when it is exposed to ultraviolet, UV, rays. How does vitamin D reduce the risk of developing prediabetes? The exact reason why this link exists is not entirely clear, but there are some theories. It may be that those with low vitamin D status are less able to effectively use insulin, thus increasing diabetes risk. Another theory is that those with low vitamin D status may be more likely to develop type 2 diabetes. It is important to note that there are many factors that increase diabetes risk, including diet and genetics. Vitamin D is a prohormone that has the ability to regulate hormones in the body, and this can improve the efficiency of the normal body processes. Having healthy levels of vitamin D is very important, and the body can be provided with this by a healthy diet. There is much debate about the benefits of vitamin D. These benefits can be achieved by taking supplements. In my opinion, vitamin D supplementation may help people who have diabetes. This study showed that high levels of vitamin D can be harmful, but Dr. Christakos said the dosage used is safe and the upper limit of what a person can safely take. Vitamin D is a nutrient that has been shown to be important for health. How to lower your risk of type 2 diabetes? Experts say that vitamin D alone won't prevent diabetes. There's no evidence that it will prevent diabetes, says Cording. We can't say it's the only factor, but it's a very good thing to do, he says. Vitamin D can help to improve health and reduce the risk of developing diabetes, but cannot replace the greater benefit of exercise and diet modification. The CDC recommends that those with type 2 diabetes adopt a slew of lifestyle changes to lower your risk of progressing to the condition. It is not a good idea to lose too much weight. Losing too much weight may be bad for your health. The CDC recommends that people losing weight should discuss the weight loss with their doctor. Exercise regularly. You should strive to get 150 minutes of moderate intensity exercise each week. Walking is a great option. Learn to manage your stress. Stress can raise your risk of diabetes. You can learn more about this and other diabetes management tips by visiting this link. Eat a good balance of protein, fat, and carbs. Try to limit added sugars. Eat plenty of fiber. Sleep about 7 hours a night. If you feel really overwhelmed about your diabetes risk, it might be a good idea to seek the advice of an endocrinologist. You may also want to work with a registered dietitian to come up with a realistic plan. Thanks for watching. Please don't forget to subscribe and hit the notification bell for more helpful content.